the first thing I'm doing is checking the patient's chart, making sure that we should be inserting the NG, that we have the order to do so. Hi, Mrs. Jones, can I come in?
Yep.
Hi, Mrs. Jones. My name is Sophia. I'm your Purdue Northwest nursing student today. So as they've told you before, we'll be inserting a nasogastric tube. Could you confirm your name and date of birth for me?
Mm-hmm.
Okay, looks good. So as I said, we'll be inserting that tube today. So it is a little bit of a discomfort procedure, not too much pain, but a lot of discomfort. But it'll only take a few minutes, and I'll be here to talk you through it. So we'll insert this tube, and we can use it for a couple different things. We can use it for feeding, for medications, or use it to suction out some extra liquid that we have in your stomach. So we'll be using it for a variety of things. Do you have any questions about what's going on?
No.
No? Okay. I'm going to start by making sure the curtains are all closed, provide your privacy. I'm just going to lift the bed up. Good job. And I'm going to assist you into a high Fowler's position, so I want you at least 30 to 45 degrees for the insertion of this tube. Alright, that's good. Alright, just going to gather my supplies. I'm going to go ahead and put this towel across your chest just in case. And I'm also going to give you a cup of water and a tissue and an emesis band just in case. And I'm going to perform hand hygiene. Put on my gloves. Alright, Mrs. Jones. So the first thing I'm going to do is go ahead and measure how far we should be inserting the tube. So I'm going to start at the tip of the nostril, go back to the ear, and then also measure it in between the xiphoid process and the umbilicus, which on you puts us about here. So I'm going to go ahead and mark that insertion site. And this will be my cue of when to stop inserting the tube. Very good. All right, you feeling okay, Mrs. Jones?
I'm okay.
All right, I'm gonna go ahead and lubricate the tip of the NG tube 2 to 4 inches. And we're going to start inserting the tube. I'm going to insert it in an upward and backward motion. And when I hit the pharynx, I'm going to have you start swallowing to help guide it down. So for now, I'm gonna have you tilt your head back a little bit, and I'm going to start inserting. All right, I feel like I hit the pharynx, so I'm going to have you go ahead and put your chin down to your chest if you can, and keep swallowing. Going to keep guiding this in, and when I feel resistance, I'm just twisting. So now that I've hit my tape marker, I am going to go ahead and secure it with another piece of tape. You feeling okay, Mrs. Jones?
I'm okay.
You did really great. Go ahead and secure this around the tube. And some facilities have a thing where we could tape it to the cheek, but for now, I am going to go ahead and use this piece of tape right here to pin it to our gown. Mrs. Jones, can you turn your head to the side for me? Okay. very good. She has free motion with her head, so I have it pinned right here. And then also, if I were to be administering anything, I would clamp this tube right here and connect it to the suction or to the tube feeding or for whatever we are using it for. Right. And then while she has this tube in, I'm going to make sure that I'm providing oral care about every 2 to 4 hours since she's going to be NPO. Make sure that her lips are moistened. Go ahead and use the swabs to clean out her mouth. And then every 24 hours, I would make sure that I'm looking at the securement and everything like that. So I'm going to check the placement of the tube I have 2 methods. So the first one would be a chest x-ray, and then for the second one, I would aspirate gastric contents out of the tube and then check the pH to make sure that we are in the right spot. All right, Mrs. Jones, you doing okay?
Mm-hmm.
Okay. Go ahead and take off my glove, drop it in the garbage from hand hygiene. And now I'm just coming back. So Mrs. Jones, we actually just got the order to take out that nasogastric tube. So we're gonna go ahead and do that, okay?
Okay.
So from hand hygiene, get a new pair of gloves. So this won't be as painful or as discomforting as putting it in, but we do have to take it out and it's not super pleasant, okay? We'll be quick. So I've still got this towel across your chest. I make sure that you have a tissue and an emesis bin for when we take it out. And I'm going to detach it from her gown and now remove the tape. All right, Mrs. Jones, I'm going to go ahead and start pulling this out. I want you to take a deep breath and hold it in. And then when it's all the way out, you can take another breath and exhale, okay? I'm going to start count to 3. 1, 2, 3. All right, great job, Mrs. Jones. We got it all out. I'm going to wrap this up in the towel across her chest. And then I would dispose of this according to facility policy. And take everything else from her and dispose that as well. I'm going to go ahead and lower this bed all the way down. How are you feeling, Mrs. Jones?
Okay.
All right, wasn't too bad. All the way lowered. Do you want to stay sitting up for a little bit?
Sure.
All right, sounds good. Well, here's your call light, and the bed's all the way low and the wheels are locked. I'm going to go ahead and take off my gloves and perform hand hygiene. Is there anything else I can get for you right now, Mrs. Jones?
Nope.
All right, sounds good.